If your doctor advises you to lower your salt intake to manage your blood pressure, I respectfully disagree. There are more effective ways to address blood pressure, which is a crucial metric for maintaining good health. This message should resonate with everyone, even those without high blood pressure. I will provide you with tools to prevent blood pressure issues. Let's start with salt. While adjusting your salt intake can yield short-term benefits, the long-term strategy involves controlling your hormones. Why is it important to maintain lower blood pressure, even if reducing salt isn't the complete solution? The answer lies in the findings from the SPRINT trial conducted in 2015. This study significantly influenced my approach to treating blood pressure. Before the SPRINT trial, I recommended that patients keep their blood pressure around 120/80 mmHg, with the systolic, top number, at 120 mm of mercury to ensure proper blood flow and the diastolic, bottom number, at 80 mm of mercury or lower during the heart's resting phase. Prior to this trial, there was a debate about whether we were being too aggressive in our treatment. The study divided participants into two groups. One group allowed their blood pressure to rise into the 130s, while the other maintained levels below 120/80 mmHg. The trial was halted early due to alarming results. Maintaining blood pressure in the 130s was associated with increased mortality. Conversely, participants with blood pressure in the 110s/70s lived longer and better protected their kidneys, eyes, and other vital organs. To understand this, consider that our bodies operate as a closed-loop fluid system, a hydrostatic system. There isn't a reservoir where you can simply adjust pressure. Instead, the pressure is determined by how much fluid is pumped and how quickly it circulates. High pressure can damage the endothelial lining of arteries, leading to hardening and other harmful changes. When patients present with high blood pressure, the first line of treatment often involves medications that lower heart rate and relax blood vessels. Personally, I aim to outsmart the hormones involved to prevent blood pressure issues from becoming part of my medical history. So, how do I manage aldosterone, the hormone linked to salt? I use insulin, which is a key predictor of aldosterone levels. High insulin levels typically correlate with increased aldosterone and higher blood pressure. In fact, if you have elevated insulin, your blood pressure is likely higher than it should be. If you have a history of high blood pressure, but want to reintroduce salt into your diet, the first step is to lower your blood sugar. You must address blood sugar levels before making dietary changes. Do not stop your blood pressure medication abruptly if you have a history of high blood pressure and, by extension, high insulin levels. It's essential to work with your doctor to manage your blood pressure effectively. This is crucial for your overall health. Controlling blood pressure without medication may seem daunting, but it is achievable through a gradual process, especially if you've dealt with high insulin levels for years. If you're looking to reverse heart problems, focus on prevention strategies. For more information, check out my next video on preventing heart disease. Remember, it's not just about cholesterol.